Welcome to InjuryGuru.com. I'm Carla Schimmelfinnig, registered physical therapist. And the common question that I'd like to tackle this week is a great question. It was a question that I was just asked in the last few days. And the question is it okay to perform the shoulder exercises in the standing position? And really that question can be related to any of my exercises and exercise programs. And the best suggestion I have for you is to perform the exercises the way I perform them in the video, unless I specifically say that it's okay to perform them in another position. My patients will ask me that question an awful lot, but usually if I'm in the clinic, we can just address the question at that time, and maybe there are other positions that they can perform that exercise in. But for the video purposes and for the website purposes, my best suggestion is just do the exercises as I show you in the video. And there are reasons for that, and I'll give you some reasons for that. The first reason, which I think is a really good reason, but the first reason is that it may be just the most efficient way to perform that particular exercise. Again, I've watched my patients for over the past 25 years, and so I know positions where they cheat when they're performing a certain exercise, and they don't know that they're cheating. They're not cheating on purpose, but just because of a certain position, it makes it harder to do, and so it's harder to keep that exercise very specific to one particular joint. A couple other reasons for performing exercises in a specific position. One could be just for safety and comfort purposes. Another reason would be that I need an exercise to be performed in a certain position because I need it to be against gravity for strengthening, or maybe with gravity to assist that. So it may be more for stretching purposes, or just to make the exercise a little easier because maybe it's in the beginning stages of a particular phase or exercise. Let me give you some examples of that. So when I say for safety or comfort, when I instruct patients to do some lower extremity or some leg exercises, one typical one that I love is called the single leg stance. And that's just standing on one leg, trying to work on your balance. So I'll always say that you should do that next to your kitchen counter or your bed or a kitchen table, and that's for safety. Another example is when I have patients do functional exercises. I really love functional exercises, and what's that mean? That just means that they're doing and moving where they're using their balance and their strength, and it's something that's more typical of what we would do during a day. So whether we go about our typical day or sport activity or recreational activity. And so for those, it's also going to be a matter of safety and comfort. Another reason or example for doing exercise in a particular position would be for that gravity or against gravity, with gravity, gravity assisted, all those different terms. So take, for instance, the shoulder. In the very first phase of some shoulder exercises or some shoulder problems, I'll recommend that you do an exercise like this, internal and external rotation, just in sitting. In another phase, I would want you to do that exercise laying on your side and just raising that arm up or that hand up toward the ceiling. And there are definitely, like I said, reasons for that. So if you're doing it in this position, it's easier. This is considered with gravity. When I know that we need to progress you, maybe you're having less pain and things are doing better, I'll ask you to lay on your side and do that exercise that way, because that's going against gravity, which is just going to make it a little bit harder and therefore work on your strength or help increase the strength in those shoulder muscles. Another excellent example for just having the body in a good position is when you're doing neck exercises. So in sitting, I like to do that one in sitting just because we can address posture, which is always sitting up nice and straight. When you're sitting up nice and straight, your neck is in line with the shoulder, and the spine are all in line with each other. And therefore, when you do the neck exercises, they're just going to be more efficient and more effective. You can do those in standing, but if I know you're sitting and I ask you to maintain a certain posture, then I know you're doing it the right way. Which leads me to the fact that we are not in the same room. So because we're not in the same room, I can't see exactly what you're doing. I just need you I want to make sure that you're doing the exercise the best way possible, so that may mean that it needs to be done in a specific position. Again, like I said, I've watched my patients for many years, so I know what are some of the common mistakes and just common ways that patients will use other joints when they're not supposed to, or not able to isolate one particular joint when I need them to. And so that's why I'm particular a lot of the time on positions. I guess that's just my little rant when it comes to certain ways to perform the exercises. And certainly, I just want you to be successful when performing the exercise programs that I have on the website. So that is my first and foremost goal, that you're successful, you have a decrease in pain, and you just get back to doing all those things that you need to do and want to do on a daily basis. So just bear with me in my particularness, and do the exercises like I have showed you in the videos, and hopefully you'll have good luck and be on your way to feeling better.